My name is Kasia. I study psychology with neuroscience here at Middlesex. I am an honorary assistant psychologist. For the first 5 months of my placement, I was based in St. George's Hospital in Tooting, in acute stroke unit. And for the last 3 months of my placement, I am in Queen Mary's Hospital in neuro rehab unit. So my role was to support a clinical neuropsychologist, and working in clinical psychology means working within a multidisciplinary team, which consists of doctors, nurses, social workers, discharge coordinators, physiotherapists, occupational therapists, dietitians, and psychology. And we often support each other in joint sessions to provide the best possible service for the patient. As a psychology team, we are mainly responsible for mood assessment and support. We are also responsible for orientating patients. We do cognitive rehabilitation, so we support patients in cognitive deficits like memory or attention. We also raise patients' insight so that they can be aware of their deficits more. It was working with people and being around them, both patients and therapists. And I also really liked that it was a placement in clinical neuropsychology, as I study psychology with neuroscience. I had a chance to implement my neuroscience knowledge into practice. So I had an opportunity to work with neurologists, and we were together looking into CT scans of people's brain. And then I had a chance to see the patient in person, and I could understand the behavioral deficits and cognitive deficits better. And I was also not expecting to have that much hands-on experience. I thought my role would be just shadowing a clinical psychologist, but I saw patients a lot. There were many challenges to this placement. The first one was switching from university to hospital setting, mostly because acute stroke unit is the unit where patients are medically very unwell and unstable, and quite a few of them died every month, which was very tough. I had difficulties in understanding the medical, clinical vocabulary, and I didn't have much knowledge about it, so it was quite stressful at the beginning. And setting the boundaries between my placement and my personal life, I couldn't switch off from it when I wasn't on a placement. So it sounds like I had quite a lot of challenges, but I'm really glad I overcame them in the end. So I developed the ability to relate and emphasize with a range of patients. I learned sensitive listening and questioning. I became an even better team player because psychology is all about a multidisciplinary approach. I also learned how to emotionally deal with situations, and I developed my interpersonal and communication skills while talking to patients, family, and other disciplines. I became confident in giving verbal and written reports, and I started to believe in myself more. My advice would be to take a placement year. Please don't think about it as if it was a wasted year or another year in education. I think you should have enough time to find a good placement, then to secure it. There is a wide range of jobs available for psychology graduates. If you think that the placement you found is not for you, that's okay, because you can fully explore the industry. And if you consider completing a placement year, please allow yourself to have enough time, secure it, and the most important part is enjoy it. Yes, the placement changed a lot. Initially, I was intending to finish my studies and do the master's degree, and then to see what the future will bring. But actually, securing a placement and meeting professionals working within the field, I spoke to them, they shared their personal experience with me. They actually advised me to finish my placement and then to go on to the third year, finish with the first class degree, which I'm planning to. And then I will secure a paid position of an assistant psychologist for a year, and then maybe gaining some part-time work experience in research, clinical research, and then applying for 3 years doctorate studies, which will allow me to work as a clinical psychologist one day. This placement year was my first step into clinical psychology, and as well my first experience relevant to the course I study. I met many amazing both patients and therapists, and the day that I will remember is my last day of the placement in acute stroke unit. Because I was there for 5 months, I felt like me and the team really worked together well, and it was a shame for me to leave them. But also I received so many warm words, and I received a cake and a card, and the patients were really nice to me as well, and we wished all the best to each other. And the therapists are still asking about how am I settling in Queen Mary's Hospital. I know because my manager still works in both services, so she kind of told me this, and it's really nice to know that people appreciated your work.